In Nepal's rural villages, thousands live with treatable eye conditions simply because care is out of reach. Through community health camps, Himalayan Quest brings essential vision and dental services directly to those who need them most. In April 2025, Himalayan Quest Foundation conducted 2 community health camps in the remote villages of Parchang and Yarsa of Naukunda Rural Municipality in Rasuwa district. Our goal was clear: to provide free eye and dental care to those who have limited or no access to essential health services. Over 2 days, our team of doctors and volunteers served more than 400 villagers, men, women, and children, many of whom had walked for several hours through difficult terrain to attend the camps. The dental team treated 172 patients, performing over 90 tooth extractions and multiple restorations. Each patient received free dental supplies and education on oral hygiene, small steps that lead to lasting change. Meanwhile, our eye doctors screened 276 individuals, identifying a high number of cataract cases, a leading cause of preventable blindness in Nepal's rural communities. 58 patients were selected for free cataract surgery, organized in coordination with Red Cross surgical team in Rasuwa. Despite landslides, blocked roads, and heavy rains, our team ensured every patient reached the surgical site safely. Over 2 days, 28 successful cataract operations were completed, each one restoring sight, independence, and dignity. During post-operative checks, patients shared the same simple words, "Ujalo dekhiyo," we can see the light again. Moments like these remind us of the profound impact of accessible, community-based healthcare. Together, we are bringing light to the Himalayas, one village, one patient, one restored vision at a time.